to be talking about the lack of coordination in health information exchange.
Good.
Why not just talk about what the problems are with the health information exchange right now?
Well, I think, Deb, if you look at the way healthcare is today, it is so complicated. Your healthcare is really everywhere. There was once a time when you maybe 30, 40 years ago, when you had one doctor, you had one hospital, and that was where your healthcare took place. You would see your doctor, he'd have all your records on hand. If you go to the hospital, the doctor would follow you in the hospital. When you got back, when you were discharged back in the office, your doctor was there with all your information. Now what happens is you have a doctor, your primary care doctor, you see him in the office, you get sent to the hospital for some illness. What happens? A hospitalist picks you up. Many of the hospitals in this area nowadays are employing what we call hospitalist doctors. They're doctors that are just in the hospital. So they see you throughout your illness while you're in the hospital, while your primary care doctor is really in his office or her office. So when you're discharged finally from the hospital, you go back to your primary care doctor. So a lot of the knowledge is now with the hospitalists, also in the hospital records, and now that doctor now has to somehow get all the information and put it together. What further complicates the matter is, suppose you had to go from the hospital to a nursing home. Now you had data from the hospital, you went to a nursing home, there's more tests done there, there's more things that happen, more things are added to your medical record. Then you may go to VNA and a few more things may happen there. Then finally you get back to your doctor. Now your doctor got to figure out, okay, where did you go? You were at the hospital. Okay, what happened there? You went to the nursing home. What happened to these drugs, these medications that I had prescribed? You're not on it anymore. You didn't take it at the nursing home. You went, then you were being followed by the VNA and other changes were made. So where is your data? That's the challenge.
It's not following the patient then, huh?
No, it's not following the patient, and certainly the patient doesn't have their health data.
Right.
It would have been easier if the patient had a folder that they carried with them with all the data, but it doesn't work that way.
So that's a problem. That's
Yes.
a problem that must be very frustrating for the physician that's trying to manage this patient. For the patient, it must be very frustrating because, they don't have their information. And I know that there's a big problem with medication, right? I mean,
that's probably one of the biggest problems is the medication lists.
And cost, too.
Cost, duplication of medication. Sometimes there's medication errors because you were supposed to be on a certain medication before going to the hospital. It may have been changed. Maybe it was discontinued. Sometimes it gets added back on. No one really knows, why changes were made because there were just so many transitions in the patient's care. And another thing that further complicates the matter is a lot of people travel these days. They go to Florida to spend their winters, or they go other places. What happens if you land up in an emergency room in another state and you don't have your medication list with you, or you don't have your summaries of your health records? What do? People are living longer, they have more health illnesses, they have more problems, people go through more procedures. They don't just live healthy and they just drop dead. You go through a lot of testing, procedures. Your health record is fairly complex.
Right. And we do know the cost of health care in this country is extraordinary.
Definitely.
And I think because of this fragmentation in the system, that duplication of tests are being done, because if a patient comes to see you and you don't know what their MRI showed and they're complaining of pain and they had an MRI in California, then you would probably redo the MRI.
Without a doubt. I wouldn't even worry about, most doctors wouldn't even ask for that MRI in Florida or California. That said, I'm going to order my own MRI because I trust my own MRI, the one that I order, because there is not that flow of proper data flow.
Right.
If that doctor were to receive the actual images or the actual reports in a timely basis, then perhaps there wouldn't be that duplication.
So not only is it bad quality of care for the patient, it's also driving up cost.
Definitely.
So what do you see as a solution for this?
Well, I think it gets down into technology, right? I mean, that technology is changing our lives. We live in a world where everyone carries a cell phone, you got YouTube, you got videos, and there's so much types of data that we deal with every day. How come it's only our healthcare, which is still all paper-based, locked in paper charts, tucked away in some hospital, tucked away in some doctor's office? Why is that not electronic? Suppose you leave town, you go somewhere, you have no money in your pocket, and you need some cash for some emergency. You know pretty much you can go to an ATM machine and anywhere, any ATM machine for that matter, take out money, and you can solve your problem. You can get that taxi, you get that meal.
They have all your information, yeah.
But if you're on